Welcome to Be a Blessing with Mitch and Windi, a no-holds-barred guide to being the best you can be so that you can be a blessing to your family, friends, and everyone you meet. Be a Blessing is about life, from parenting to building a business and building yourself. Mitch and Windi will cover it all. So buckle up and prepare to get uncomfortable, because growth only comes from the other side of a challenge.
Morning. Welcome to Be a Blessing with Mitch and Windi. Today is episode 19, which is kind of ironic because we're talking about COVID-19
We didn't
morning.
Didn't even plan that, Frank. Didn't even plan it.
Right. So today's special guest is Dr. Bridgett Foreman from the Freedman Clinic. She's here to talk about all things COVID. Data, bringing data in, drawn from her personal experience as a professional in this setting, because we realized, and we were victims of it. I mean, I think everybody is, if you're being honest. We're all inundated with so much information, conflicting information, and I have compassion on all of us in humanity, but there's so much information that's just driven by political views and driven by just so much garbage that it's throwing everybody into confusion. Yeah. So we have someone here who is just going to talk facts, talk data, talk about experience, and we're just kind of...
And she's smarter than us.
Yeah, way smarter. I mean, yeah.
And all full disclosure here, I'm going to let Windi and Bridgett kind of take the lead. Windi was previously a nurse. I'm still currently a nurse. We know, baby, you got your license. But so because they are the medical experts, I'm just the insurance guy. I'm here for, just to make everybody laugh every now and then. But real quick, what most folks won't know, and I always like to bring up kind of the history, we all kind of go way back. Bridgett was originally from Pine Prairie, which is where Windi and I grew up. She's a little bit younger than us. We're old now. I'll be 40 next month. 40. So real quick, before we jump into all of that, give us just a brief background on all things Dr. Foreman.
Sure. So grew up in Pine Prairie, as you said. Then I went to Louisiana College in Pineville for undergrad, where I double majored in biology and chemistry. Then went to Shreveport for medical school, so 4 years of medical school there, and then stayed there for another 4 years to do a combined residency in internal medicine and pediatrics. I served as chief resident there my last year. Then moved back here, home. So Alexandria is, pretty close to home, as you guys have a lot of patients who come, from home. Where I joined the Freedman Clinic, and it's pretty interesting in that I see the whole spectrum. Babies, I see newborns in the hospital the day they're born, and I think my oldest patient's 103.
Wow.
I see patients in the hospital, I see them in clinic, and so inpatient, outpatient, the whole spectrum of age and acuity. The only thing that I don't do is ICU level of care. So if they're sick enough to go to the ICU, I hand that over to the intensivist. But other than that, I'm seeing it all.
So you have a lot of varied experience then with all the different types of patients you're seeing.
Yes, absolutely. We've been taking care of patients on the COVID unit from the beginning of this. I take care of outpatients with COVID. I see kind of the full spectrum, apart from once they're sick enough to go to the ICU. I kind of watch from afar and kind of check in on them, but I'm not actively managing them when they get to that point.
Yeah. Now you were, again, I just said how smart she was. Weren't you Valley Victorian? Yeah, so she's always done really well.
Yep. I mean, yeah. But so going through all of that, here we are 18, 19 months into COVID. Have we seen the worst of it yet? Why or why not?
So I don't think so, unfortunately. Whenever we look at kind of the historical data on pandemics, they kind of come in these waves, right? So, you get through this first one and you think, oh man, that was really bad, but it's really just kind of that first blip. And then you see the next surge kind of come, and now how many waves is it going to be? It's hard to say. And the unfortunate thing about COVID is that it's one of these viruses that has a tendency to mutate and do so frequently, as we're seeing all these variants kind of coming. Right now, we're in the worst of it we've seen in this area by far. We have far more hospitalized patients. We have sicker patients right now than we've had at any point. And we were hoping, after kind of that third wave and the vaccine came, and we kind of had this hope finally of something that's going to slow this down, that would have been the worst of it. And unfortunately, the vaccine uptake has been slow. We are not much further along in really good treatment for COVID. And so I think I think we still have some pretty hard times to come.
Yeah. So let me ask you this, because I'm like you, and I'm just an average guy that's just living through this like most folks. You have a different lens as you're in the medical field. Obviously, you're smart. You can interpret data in a way that I can't. And so I'm like you. I thought after the third wave that we had, and it felt like it was over. I felt like life was back to normal.
We had a wonderful summer, didn't we?
I know, and they were like, you take off your mask. Like, we were high-fiving. We were like, woo!
You know, and then it's like all of a sudden, Windi and I like just started having conversations. All of a sudden, it felt like a bunch of people that looked like me were getting really sick with COVID. And it was, that kind of caught my attention, whereas previously we were aware of it. Obviously, when it first happened last March, April, May, we were all scared. We were wiping down our groceries. Like, we didn't know what this thing was.
Exactly.
So, but once we kind of got into the thick of it, it looked like, okay, this is who it affects the worst, the elderly and the really sick type folks.
That's right.
We got COVID in December. It kicked our butts for about 2.5 weeks, but nothing like going to the hospital. And so all of a sudden, here we are, third wave passes, and guys my age who are healthy are on ventilators.
That's right.
And it really kind of scared us, I guess, for lack of a better term.
And honestly, he and I kind of thought a certain way. We were very similar in our thinking. And then when this third wave hit, we started seeing people we know personally being affected in a serious way. We were like, well, we thought this way, but what are your eyes telling you?
That's right. And we've seen that. So this most recent surge has been primarily because of Delta. And just like any basic living thing, this virus wants to survive. And so as it replicates, viruses can't replicate on their own. They require a host to replicate. And so its reproduction cycle requires a host in order to take over their cells, make copies of itself, and then release. So ultimately, these viruses don't necessarily want to kill their host. They want to spread and infect as many other people as they can so they can continue to propagate. And their replication cycle is so many, it's millions and millions and millions of times that it's making copies, and so mistakes happen. Sometimes those mistakes mean that virus doesn't survive and it doesn't work. But sometimes that mistake actually gives that virus some benefit that makes it either more deadly, more contagious, or maybe less deadly. So we saw this about 100 years ago whenever the flu swept through and killed lots of people. This was a horrible pandemic. It's difficult to compare numbers of death because the population was obviously less, but percentage-wise, it killed more of the population than what we're currently seeing with COVID. But then it mutates, and then it becomes a more mild flu. Now we've got the flu that we see that goes through. It causes some deaths, but it's not...
It's maintainable.
Right, so it causes some hospitalizations, it causes some deaths, but it's not overwhelming hospital systems. It's not having people dropping dead like they did during this huge pandemic. So we can hope that COVID will eventually mutate to, maybe it's contagious, but maybe most people are having cold symptoms. Maybe you're sick for a week and you miss work, but you're not being hospitalized for a month or two. You're not on a ventilator. We're not seeing the number of deaths. So that's kind of, at this point, I think the end game is that we get to a point where COVID is serious, but not this serious that we're seeing now.
So, and I'm sorry, you go ahead.
That's okay.
I just have questions firing off my brain.
I know. So
Go.
At this point, what is your biggest obstacle in treatment of patients with COVID?
So the problem is we still don't have a good treatment. The monoclonal antibodies have been very helpful if you catch it early and you do it before you're very sick. And so those have shown to be pretty effective at keeping people out of the hospital if they go and get the monoclonal antibody. Once you're sick enough to be in the hospital and require oxygen, we have steroids, dexamethasone, prednisone. And the studies, there were lots of studies going on when this first started, lots of different places, randomized controlled trials, people trying anything that they could that might make a difference. And most of the time with viral illnesses, steroids are plus or minus. Most of the time they don't help that much. But we found that once people were hypoxic, meaning they needed oxygen, that the steroids helped. So we start steroids. If you start before you need oxygen, that was shown to show no difference and may be harmful. So we don't give it as soon as you're diagnosed. We wait till you're sick enough to need oxygen. But if you wait too late, then they don't really help either. And once you're down that pathway where you have severe hypoxia and multi-organ dysfunction, we don't have many options. We throw all these different medications and a hope and a prayer and time. Ultimately, most viral illnesses that we know, we have cures for very few. So we can cure hepatitis C now. We can manage HIV with long-term medications, not cure, control. You think about like people who have cold sores and HSV breakouts. We have acyclovir that can kind of control the flares but not cure. Most viral illnesses, you think about your kids when they've got a cold. What does the doctor say? It's a virus. It's got to run its course, right? Go home, take some Tylenol, suck out the snot. You'll be better in a week. Or you won't. One of the two. And so this is really not much different than that. It's got to run its course. And we have very few interventions that truly make a difference in treating them. And I mean, one of the patients of our practice has been in the hospital now for over 2 months. They sit and we wait, and they either get better or they don't.
So let me ask you this real quick. I'm thinking.
Okay, and I want to follow that.
Okay, so what should somebody do? Like, I'll tell you, like in our experience, as soon as I ran fever, I say I'm getting tested early so that they maybe have some sort of a treatment. And whatever was working probably back in December may not even be a treatment option now. I don't even know. Because when I talked to the doctor, when I had a conversation with them, they were not offering that treatment any longer. So, because I guess things are constantly changing.
Things are constantly changing. We're getting more information. And so in the beginning, whenever we look at therapeutics, we think, one, is it helpful? Is it going to help this patient? Yes or no? And sometimes the answer is, we don't know. So then the next question I have to ask, will it hurt? Is it harmful? Because if it maybe plus or minus will help, but is harmful, I probably shouldn't do it because my risk of hurting you or making things worse, right? And so those are the two main questions. And, in the beginning we heard things like vitamin C and vitamin D and zinc and, all these different vitamins.
I take them every morning.
Because
Wendy's like, you take your supplements? Yes, Mom.
So those fall into the category of, do they help? Maybe. Do they harm? Probably not. So you might as well try it. And if you get some benefit, great. But where we start to worry are whenever people start doing things that are harmful, that are not going to help or probably not going to help, but have serious risks associated with them, we probably ought not do those things.
Okay. Ask you a question. I got one. Hurry.
Just to help validate what the viewers here to date, give me a rough number of how many COVID patients you have personally treated.
Oh gosh, I don't know. It's probably in the hundreds. They're not all just my patients, so to kind of give you probably hundreds outpatient. Inpatient, I've had a few of my patients that have been my long-term patients that I've hospitalized for COVID. I see my partner's patients when I'm on call, or if they're off for whatever reason, I see them on the COVID unit. And then also pediatrics. So if you would have asked me this a month ago, I would have told you as far as pediatrics go. So I'll clarify and say I'm the pediatric hospitalist at Cabrini. So those aren't just my patients. Any pediatric patient who gets admitted to Cabrini is seen by either my partner, Dr. Broussard, or myself during the week. We have some kind of coverage on the weekends. But this, no matter who your pediatrician is, if you're in the hospital, you get one of us. Okay. There's a few that still come see their own patients, but not many. So up until a couple of weeks ago, I saw very few children with COVID. I saw one who came in for surgery, like he had an injury, and we had to test him prior to going to surgery because they have to wear like the full PPE if they're going to intubate this child to perform surgery. And he tested positive but had no symptoms. So it was kind of coincidental. He didn't get hospitalized for COVID. He got hospitalized for his injury that required surgery. That's changed dramatically over this surge. So just this past month, we are seeing the youngest baby I had was only 3 weeks old.
Wow.
And we've had preschool age kids, we've had infants, we've had toddlers.
Who were being hospitalized because of COVID.
Because they're sick with COVID.
And this is as evidence what we were talking about, the mutation of the virus. It's mutating in order to survive its self-preservation.
Right. And so who's vulnerable now, right? So in the first few waves, as you said, the elderly either died from it, or they've had it and recovered, or they've been vaccinated. And so that population is not as vulnerable as they once were because it's kind of already taken out those that it was going to take out, and those that have had it and recovered have some amount of immunity left. And so what's left are who's vulnerable are the unvaccinated, so younger adults and children. And because this is so much more contagious, the initial one, and we talked about how contagious it was, but each infected person probably infected 1, 2, maybe 3 other people. So we had people who would live with someone who had COVID and not get it. You lived in the same household. You didn't take a whole lot of precautions.
She gave it to me.
Oh,
you did that to me.
But we saw that. We saw why, my husband had it and I took care of him this whole time and I never got sick. And that would happen before. We're not seeing that with Delta. With Delta, each person can infect 8 to 9 other people.
That's crazy.
So it's a lot. Household transmission is almost 100%. So if you're living with someone who has COVID, it's almost guaranteed you're going to get it. You're not going to go through and not get it.
So talking about the Previously, it was elderly, more sickly individuals. Now it's people like us and younger. Is it because, and that's just mind-boggling to me. So is it because it's the path of least resistance now? Previously, the path of least resistance for the virus was those individuals. Now they've either died or recovered or probably got vaccinated. So now there's a level of protection. So it's not finding it there, it's going
to where people are vulnerable. Exactly.
So that's how it's.
And the people who are in those categories are much more afraid. They've been afraid this whole time.
Yeah.
So they're probably taking more precautions and not going to the birthday parties and the weddings and the restaurants and all the places where all the people are.
Yeah.
You know, they're the people who are going to the grocery store early in the morning wearing their mask when there's not a lot of people, or they're still doing grocery pickup. You know, they're doing church online maybe, or they're wearing their mask and going to the early services. They're not out there taking risks. And we talked about, you know, COVID was over this summer, so what did all the young people do? Yeah, yeah.
Guns a-blazing.
Yes.
Exactly. And so that's kind of ripe for those types of mutations to happen and to spread. And as a physician, I get a little bit frustrated whenever we talk about just the personal decisions, saying, oh, well, it doesn't affect me. It only affects the people who are sick or the people who are elderly. But those are still people. Right. Those are still people that we should care about, and we should care about deaths in those people. But it feels different now whenever we don't have something to blame for the illness, you know, that these people were otherwise healthy and young, and now they're very sick.
Yeah. And that was going to bring kind of a segue to my next question is, what is one of the biggest myths you hear over and over from your patients that you just want to bust wide open right now and clear the air on?
That it can't affect you. Right. I mean, that's kind of the big one, that you think
I'll take my chances.
You are out, right, exactly. And I've seen it affect young, old. It doesn't matter what your religion or your political party. An interesting story that just kind of makes me laugh a little is I have patients who have things like pacemakers or, you know, medical interventions that are literally keeping them alive. You know, if you take out the pacemaker, it's telling your heart to beat, okay? Yeah. It's electronic. It is the very definition of an intervention that we are doing that interferes with the natural progression of things. And I have patients who won't take the vaccine because when it's my time to go, it's my time to go.
But we have a pacemaker keeping you alive.
The irony, right?
Yeah.
Right, and I got like 8 stents in my heart and everything else. Like,
and when they're sick, they come and they say, oh, you know, I need antibiotics and steroids, and you're not going to give me all these things that they want to fix whatever problem you have, but they don't want to prevent the problem before it comes. And they're so afraid of the vaccine, and they're so afraid. And that's one of the things that's difficult. And I empathize with people. I understand everyone's afraid. I don't care where you are on what side you take, people are afraid.
I got a question.
Yeah.
So we're going to arm wrestle over the next one.
So how, from your position, like, it's mind-boggling to me. Like, how does all this disinformation get out? So in other words, like, I reached out to you because I'm doing my own research, and it's hard to find good research. Like, you find all this biased, political. I just want data. Like, show me the data that's truly.
We turned off the news. We turned off social media. We turned off influencers.
And this was like right around the time we started getting serious about it.
Because we started seeing people who look like me getting this virus, and I was like, I don't care what the truth is. I want to hear it. Just the truth, how ugly it is. I want to hear it.
And so I'll tell you from my perspective, you know, my social media probably looks a lot different than yours.
Yeah.
Because, so yes, I'm from Pine Prairie. I have all of those friends. I have the people that I went to high school with, the people from my hometown, the people that I know. And then right beside them, like intermixed in my feed, are people that I trained alongside in medical school, in residency, mentors of mine. And the dichotomy was astounding. Yeah. People, and I rarely post on social media. I'm not, you know, someone who's posting every day. Or
you're a doctor, you're busy.
I rarely post, and I try and keep a lot of my opinions to myself because I don't want my patients to feel like they're judged by me. I don't want them to think that if their views are different than mine, that I'm going to treat them differently. So I keep a lot of that stuff kind of to myself. And a lot of my colleagues are similar. I rarely see them post on Facebook. And whenever I scroll and I just see people begging and pleading for people to get vaccinated, and they're all telling these stories of what their day has been like and the terrible things that they've seen, it gives you this pit in your stomach of knowing what's coming that the rest of the world doesn't see. And I'll tell you, the hospital is full, and it doesn't matter what your issue is. If you're in a car accident, you have a heart attack, you have a stroke, you have appendicitis, we don't have the room for you. You're going to sit in the emergency room for hours. We had, ICU beds are hard to come by. So even if you're in the hospital and you then code, we might have a ventilator, but we don't have the room to move you to the ICU where the ICU doctors and the ICU nurses are. You're stuck. If you have a problem that requires a specialist that's at a hospital in another city or in another state, they don't have room to accept a transfer. So you sit here and you wait, and maybe you have a worse outcome because we couldn't get you care in time. And so it's not just the people who are sick with COVID. It is the strain on the system that means that nobody's getting the care that they need.
And I think it's hard for people who are far removed. Here's the talk about irony. And I'm part of that. I think Windi probably has a greater pulse on it because she still has a lot of friends in the medical field, but sure. I'm still one step removed from that. But we are literally in Louisiana right now. It's the worst it's ever been. But for people like me, it doesn't feel like it's the worst it's ever been, because at this point, we're not as scared of COVID as we previously were, because we're now 19 months into it, and we all have formed opinions, whether they're correct or incorrect, right? But literally just had the highest death count on a daily since the pandemic started, 2 days ago? Yeah. I saw a post. Yeah. People are dying more right now daily than ever before.
That's right.
And everybody's like, no, everything's cool. It's like, you remember what it reminds me of when we watched Titanic and the symphony is playing and the damn ship's going down.
That's exactly how
I feel like that's what's happening. The ship is going down. And I'm not trying to convince anybody of anything. This is just reality.
That's right.
Like, the ship is going down. We're over here.
It's been 18 months. And so people are just numb. They're tired of hearing about it. They just want to move on with their lives and go back to normal and not have to worry about it anymore. And for people who aren't in it, it's easy to do that until it affects your family. Until it affects your friends.
Some folks from Glenmore, the father died,
and then the daughter.
And the daughter died the day they were burying
That's
him.
Right.
And it's like nobody cares until some terrible situation like that happens, and it's happening.
I'll tell you, there were multiple family members that were all hospitalized on the COVID unit, and one of the worst things I can imagine is the parent hearing the code blue to her daughter's room.
And there's nothing that they can do.
There's nothing that they can do.
It's just sit there and weep with a little bit of energy.
And when you think about that, and they're both hospitalized, and you hear the code blues going off, and they're almost always on that floor, and to know that that's the room that your family member is in, and you're stuck there too. I mean, it's just terrible. So going back a little bit, when you were talking about how do we find the data and how do we know who to trust? So one of the things is, we go and we listen to this guy give a very passionate speech about what he thinks and gives his opinions as if they're fact. But what do we know about this person? What was their training? What is their background? What are they doing? How many COVID patients have they cared for? Where's their data coming from? And so it's easy to listen to these guys, and it's kind of like preachers, right? You can get people who go up there and say all sorts of things that makes you feel good or makes you get fired up, but who knows if what they're saying is really sound information or not. Yeah. You kind of have to do your due diligence and check into that. So one of the things that we learn in medical school and in residency is how to look at studies. Is this a good study? Did they have enough people? Did they measure what they set out to measure? Was it powered enough to determine whether or not this was effective or not? You guys, have gone and said that I'm smarter than you guys, but I'm also, only a few years into being out of residency. So what do I do whenever I don't know and I'm confused by how much data? I go to my mentors. I go to the people smarter than me. I see what they think about it. I see what their takes on it. One of those folks is an MD PhD whose focus is pediatric infectious disease. So he's a pediatric infectious disease doctor who has an MD and a PhD in microbiology, and his focus has been on virology. So when I trained with him, these swabs that everyone's, the brain biopsy, you got to go all the way back.
Yeah, right. It touches your short-term memory.
We've been doing this since I was in medical school there for flu and RSV, because part of what he studied was epidemiology and what viruses are going around and how, And so I've been doing those on kids and adults for years, well before COVID came out, these little PCR swabs, the little pink media that you got to put them in. And so he's one of the people that I talk to, and he's a champion for vaccines, and he's done a lot of vaccine research. And so when all of those people that you trust and that I would trust him with my life, with my children's lives, and I have, he's cared for one of my kids when they were very sick. When those people all come to the same conclusions, it gives you a lot more confidence in in that data as opposed to some kind of random person that
Some guy talking to the school board up in Massachusetts.
Yes.
So let me ask you this, since we're talking about the vaccine. Like I said, this isn't anything other than, let's just talk data.
Sure.
So what are the facts about I'll tell you what our initial thoughts were. mRNA, it's brand new.
Sure.
Okay, so you helped me on that issue.
Well, first of all, and let's clear the air on this. Do you have anything to gain?
Nothing.
From today's conversation?
Zero. So even my patients come into my office, I tell them, I have zero ulterior motive. I get paid $0 if you take the vaccine, if you don't take the vaccine. All that it does is this conversation is long and I run behind, and it means I've got to catch up on charts tonight instead of getting my charts done before I leave, because these conversations are not short ones. I can't just say, have you had your COVID vaccine? No? Okay, go get one, and walk out the door. That's not how it goes. There's a lot of things to unpack and to talk about. And so when I talk to patients, I say, what is the thing that scares you? Yeah. What is the thing you're worried about? What's your hang up? And so that I can address the thing that has them nervous about the vaccine. And for a lot of people it is. It's mRNA. This sounds scary. Isn't that like your DNA? Sounds similar to DNA, right? So mRNA technology and them kind of going into this goes back to the early 90s, is when they first started looking at mRNA and how can we implement this. And every time there's new technology, it's not always what you think you're going to use it for is not always what ends up being the most useful application. So
like Viagra.
Exactly. That's actually the example I had in mind.
Yeah.
So, that was for pulmonary hypertension, right? And then they found this very interesting side effect and said, hey, we can make a lot more money doing that. And so these pharmaceutical companies, they can't have all their eggs in one basket. They always have multiple projects going on that they're looking at different technologies, and maybe there's a few guys working on this, a few guys working on that. And so each time that something has come up, so with Ebola, with the original SARS, with various different, they've looked at it for RSV, they've looked at it for HIV, they've looked at this technology for a lot of different applications. And thankfully, Zika and Ebola didn't pan out to be a huge widespread thing, so we didn't need to mass vaccinate people. And in general, vaccines have been a victim of their own success. So when's the last time you heard of somebody with polio, tetanus, measles, mumps?
Yeah.
Anyway,
the president had polio years ago. What was his name? President Roosevelt, Franklin, whatever one. That's the last person I knew.
Diphtheria. Do you even know what diphtheria is? Probably not. Most folks don't, because it's gone. We don't see it. You don't hear about it. Even chicken pox. I had chicken pox as a kid, but I've never treated a child with chicken pox.
Right.
Is it gone? So there's a vaccine for chicken? Did our kids have chicken pox?
They probably had hand, foot, and mouth.
Yeah, they did. They had
one little bump. I was like, that's not chicken pox. You're going to be covered. I'm sorry, I'm getting way off.
It's okay.
Course
it's
here,
okay.
It's because I brought them to all their wellness visits.
Yeah. So it's okay. So vaccines, people our age, they don't know what these vaccines are for. You just go get your shots. What disease is this? I don't know. The doctor said I get it. I got it. Mm-hmm. But they don't know how bad these diseases were. And so it's easy to then say, well, that's too many shots. How are these shots going to hurt me? Because they've forgotten, or they never knew how much protection they're giving you. Yeah. And so now it's a new vaccine. And you ask me, do you want this brand new vaccine? And I say, oh, probably not. I'll give it some time. But it's different when there's a pandemic, because my option isn't, do I want this vaccine or not? The option is, do I want this vaccine or do I want COVID? And maybe the answer is both. So do I want to get COVID with the vaccine on board, or do I want to get COVID without the vaccine on board? Because that's really what we're looking at now. So I got a little off track. Let's go back to the mRNA. So what is mRNA? So go back to like high school, middle school biology, have your little cell model, right? So inside the nucleus is where your DNA is stored. So that is the genetic code for everything that makes you who you are, right? And so how does the information from your DNA go out and produce all of the things that make you you? So you have basically like this little transcriptionist who goes and he looks and writes down the instructions. And it's all very simple. There's just 4 different types of nucleic acids, and they pair. So an A always goes with a T, a C always goes with a G. And so these complementary pairs, it goes in and it creates this basically mirror image copy of that particular strain. And it sends out messenger RNA. So it's made in the nucleus, and then it goes out of the nucleus out, and it finds a ribosome. That's those little dots. You probably used raisins or something to make your little thing. And those guys basically just read instructions and build whatever it is that they're told to build. They have no mind. They don't care what they're making. They just find the instructions and they build it. So it's like the IKEA instructions, right? So it takes 3 of the amino acids, so whatever sequence that is, codes for a specific amino acid. Those are the building blocks of proteins. What are proteins? They're channels, they're the structure, they're the actual things that make you what you are. So this is instructions for building proteins. It goes down the line and it has this other little guy who brings them the pieces, and they make these pieces in a long chain. The long chain builds up into a three-dimensional structure that does something, okay? And then it's got instructions on it that tell it where to go. Does it go to the surface? Does it go outside the cell? Does it stay in the cell and do whatever it's supposed to do? So the way previous vaccines worked is we took something like the actual virus, but we deadened it or we weakened it so that it couldn't cause severe disease. Or maybe we just gave a little piece of the coat. So whether that is a piece of protein or it's part of a sugar substance, we gave a piece of that pathogen and we gave it to your body so that it could recognize it. And your immune system kind of simply recognizes things as either self or foreign. And so if you give something that is foreign, then it goes and, this guy's kind of looking around and says, hey, this doesn't belong here, kind of raises a flag and recruits all his buddies to come and look at it, and they all kind of attack it. The first time it goes and it's not really that severe of a response, and it's like, oh, we got him, we're good. But then the next time that you encounter that same thing, it has memory. It's already passed its picture around to everybody else, and so when it comes in, everybody's ready, it mounts this huge response. And then it gets rid of it before you ever even get sick. You never even knew anything about it. So that's the ultimate goal, is just to prime your immune system so that it knows to recognize this and fight it when it encounters it. And so how we do that is how these different vaccines have come. So instead of giving the actual protein, which takes time, you have to grow these proteins, you have to develop them, all of these things. And then sometimes if I inject this protein, maybe it doesn't get the immune system's attention. So you have to give like an adjuvant along with it that is basically, its whole purpose is to make the immune system angry and bring its attention to that object that you want it to recognize. And so that's what some of these additives to the other vaccines are that also are a whole other set of controversy that we'll leave that alone. We're not going to go there. Yeah. So this one, instead of sending in the actual virus or a protein from the virus, is just sending the instructions. And so it sends in the instructions, your ribosome picks it up, it doesn't know where this mRNA came from, it just finds it. And it says, okay, well, let's build it. Here's some of my key instructions, you got it, we'll make it. And it makes a viral protein. And then that viral protein goes out and your immune system sees it and says, hey, what's this guy? We didn't make it. And it recognizes it. Yeah. That's right. And so how's this different? Well, if you get the virus, this is how the virus replicates. Remember I talked about it requires a host. Yeah. And so it goes into your cell and it uses your cell's machinery to make entire copies of itself. It makes copies of its RNA, it makes copies of its proteins, and then it repackages itself and then releases out tons of full copies of that virus. And so instead of we're kind of taking a play out of their book, right? Mm-hmm. So we're using your own cell just to make the spike protein. It's not making whole copies of the virus. You can't get COVID from the vaccine. The symptoms that you have, the fatigue, the headache, the tiredness, all of the symptoms are the symptoms of your immune system mounting a response. That's what makes you feel bad, is your own immune system working.
Yeah. Isn't it? I just drew away two things. I was like, isn't it God so creative?
Yeah. It is.
He is just so.
It's a really neat. So whenever this technology kind of came out, those of us who were kind of science nerds, it was really kind of fascinating, intriguing. Yeah, it's exciting to see the sophistication and yet the simplicity of it. And so this technology, going back, they've used it in certain like melanoma treatments. And if you've heard of people who have cancer.
Wait. So we've been using
mRNA technology.
Okay.
We have.
Maybe I didn't know that.
Yes, so they've been using it in certain melanoma treatments. Okay. And then you may have heard of immunotherapy as certain cancer treatments. Yep. So what is cancer? Cancer is self. Cancer is your own cells who have gone haywire. They've mutated and they're not doing what they're supposed to do. They're growing unchecked. And so the immune system is trained to recognize self, leave it alone. Foreign, attack, right? So if you have cancer, it's recognizing that as self and is ignoring it. It's saying, I don't care, you can do what you want. But if I use immunotherapy and try and teach my immune system to attack those cancer cells using certain markers, then I get my immune system to help me fight this cancer instead of just chemotherapy drugs.
And so we use mRNA to teach the body?
So that's not the only type of immunotherapy, but yes, mRNA technology has been used in certain melanoma treatments.
And it's not a brand new thing that's introduced
so that's great.
into the medical world.
So we can conclude that we've been studying it.
This is a 30-plus year thing.
And we're currently have used the technology to help sick folks in other capacities.
Yes.
So let's talk about, because we're getting late on time, I want to be make useful of our time. Let's talk about the effectiveness of the vaccine. I don't know if that's where you're headed, but let's talk about the effectiveness of it.
So the initial stuff was really incredible. We had 95% effectiveness. Now, we have to look at the context because, Moderna and Pfizer were kind of the forefront, and these are the mRNA vaccines. Johnson's a little different. And they did a good study, and they had a large number of people. So how did this happen so fast? That's kind of the lag time about, other vaccines have taken years to be developed and things take a long time. Well, one, you're in a pandemic, so the incidence of the disease is high. We're seeing tons of it. So you can put people in a trial, and people are lining up to get this vaccine, right? Like, you're not having to really I'll pay you $100 to be in my study. Yeah. You open it and people are signing up. So they got large number of people very quickly. And then you give some of the people the vaccine and you give some of the people placebo, and you watch them to see what happens. Who gets COVID, who doesn't get COVID, who has adverse effects, who doesn't, that sort of thing. And they compare the two groups. The patients themselves don't know what they got. They don't know if they got COVID. They don't know if they got placebo. So since they didn't know what they got, at the time the study was being done, people were still masking, people were staying home, people were not taking risks that we're taking now. And so we got this 95% effective against getting COVID. So between the two groups, there were some people who still got COVID, but it was very, very few. In the vaccine world, that's incredible. That's better than we could hope for. Most of the vaccines we take now are not that effective. They're effective because the whole population gets them and the disease isn't circulating. Yeah, right. But anytime that you have a surge of the disease, then you're going to have some breakthrough cases, like we've seen with measles recently. Remember in Disney World and some of these other places where you have some unvaccinated populations. Johnson looked to be a little bit less effective. However, when it was doing its trial, was in the middle of a huge surge, and so there was more COVID kind of hanging around, and it was more across the world compared to the Pfizer, Moderna, were more.
And so it's just going to look like it's going to
look like it's less effective.
Yeah,
Exactly. So the numbers are hard to compare one-on-one, but by and large, what we are seeing throughout was that the vaccine was very good, and only recently have we been seeing very many people who've been vaccinated testing positive for COVID. And we are seeing some folks who are testing positive for COVID who've been vaccinated. Most of these people were either recently vaccinated and maybe haven't gotten to the point where they're fully vaccinated, or they were vaccinated a long way back. Yeah. But what we're seeing are much milder courses, which is still what the overall goal was. The goal wasn't to say that no one's ever going to get COVID, but man, if we could prevent people from being hospitalized, if we could prevent people from dying, that's the goal.
That's the win. If I can stay at home and treat myself under a physician's guidance rather than being intubated, I think it's a win for everybody.
Or taking up room in the hospital.
That's right. So that's the ultimate goal is to render this, that's the same reason we give the flu vaccine. The flu vaccine is not nearly as effective as the COVID vaccine is, but we take it because it reduces deaths and hospitalizations. You may still get the flu, but hopefully it's a milder case and you don't have the complications. And so I think of it similar to a seatbelt. So if I wear my seatbelt, does that mean that I 100% won't get into a car accident? No, it doesn't have anything to do with getting into a car accident. But does it mean that I won't die if I get into a car accident? No. But if I look at the number of people who were in car accidents, the people who wore seatbelts were much more likely to walk away from that car accident than the people who didn't. And so that's kind of where this vaccine efficacy comes. And if you're looking at the news, they're reporting these numbers constantly, and they're saying 90% of the people in the hospital were unvaccinated. Oh, but that means 10% of the people were vaccinated. That's true. So 10% of those people who were vaccinated or that are hospitalized had been vaccinated. Maybe these are elderly people. Maybe these are people who are immunocompromised and the vaccine didn't work as well in them because their immune system isn't very good. But the vast majority of the severe cases we're seeing are in unvaccinated people. And that brings me to one of the things that was going around for a while up in the Northeast, where there was a breakout in a large group of vaccinated people. And so it said, well, 70% of the people from this breakout were vaccinated. But this is in a place where like 80% of the population's vaccinated. So of course those breakouts are going to occur in vaccinated people. But if I compare that and say, okay, well, maybe there were 100 people who got it from this event. If that population had been unvaccinated, the numbers have been much, much higher.
And that's a question I wanted to ask you. You think we're seeing, you just said 90% locally unvaccinated versus 10% vaccinated. If we had 90% vaccination rate here, those numbers probably would look different.
Well, sure, because if the vast majority of the population is vaccinated, then I'm going to see cases in vaccinated people. But I can bet you that my number of people hospitalized at my hospital won't be 73. it would probably be more like 12,
Yeah.
right?
Which
And
opens up the rest of the healthcare system.
and then we
for-
can function.
Yeah,
And then we can function. So there will always, vaccine or no vaccine, there will be people with COVID. There will be people who get sick with COVID. It's a numbers game. We want less people to be severely ill from COVID.
Sorry, baby, I'll keep
No,
interrupting you.
I think we've kind of covered everything, actually. I mean, one form or another.
Yeah.
we've
So
covered it.
we can safely say, statistically, the vaccine's safe, because I see a lot of folks talk about these side effects. That's the last thing I want to address. I mean,
Sure.
I don't know how they get in my feed, but I got certain people just they
know.
have videos of people
I know.
shaking and like this was caused by
and
the
foaming
vaccine.
at the mouth. You think it's a
Like, is the
rabbit
government
episode.
hiding what's happening to people?
No.
Like where are they
don't
getting this
know.
stuff? Like,
know.
it scared me. I was like,
know.
I don't want to shake. I don't want to have Parkinson's because I got the vaccine.
So that's interesting because people take things in kind of different ways. So one is that initially people were angry at us saying that we're calling everything COVID, but it's not COVID. Someone's had a heart attack and you said they died from COVID.
Yeah.
But if we look at the base rate of deaths in a given year, and then you look at what's happened over the past year and a half, no one can deny that there's an excess number of deaths, right? So there's more deaths than there should have been in the past 18 months. And so that's a very rough way to say, if I look at what the number of deaths should have been, and I look at how many extra there are, that I can attribute that to COVID. Regardless of going through and looking at death certificates, that's a rough way to say this has been the toll of this pandemic, okay? So if the same thing happens if I go into, say, a nursing home, and I give every person in that nursing home the vaccine today, well, in a nursing home, you've got elderly people, you have sick people. There's a certain number of people who are going to die in a nursing home in any given month. And so what if somebody dies 2 days after they got the vaccine? Was it from the vaccine? It's very difficult for that person's family to say that it wasn't related to the vaccine, because to them, they just got a vaccine, right?
That was the only change in care.
That's the
they
only
had
thing that was different.
received.
But if I look at the total number of deaths and the rate of deaths in the nursing home population for that period of time, it doesn't change.
Yeah.
Right? So sometimes it is coincidence. Sometimes it is just that if I give a vaccine to a lot of people. So another one that went around was Bell's palsy. Well, Bell's palsy happens kind of at random, out of nowhere. Somebody has Bell's palsy. Can it be from the vaccine? I don't know. But when they're looking at the data and they're saying, is it happening at an increased rate amongst people who just received the vaccine compared to in the general population? And the answer was no. Same thing happens with Guillain-Barré. So we've had some people who've had Guillain-Barré after getting a vaccine.
You're getting out of my
So
understanding.
Guillain-Barré,
Yeah.
and we talk about it with flu vaccine, it's an ascending paralysis type of situation. And so the typical course for Guillain-Barré is it happens after a viral illness. We've seen it after people have had the flu. We've seen it in people who've had COVID. We've seen it after vaccines. So the question is, would this person have gotten Guillain-Barré after having had COVID when they had it after getting the vaccine? And the rate doesn't seem to be different. This vaccine has been looked at more and scrutinized more than any other vaccine. So V-Safe, it was a program that they had. They texted me like every day for like 2 weeks, and then every week for a couple of months, and then every month till 6 months out, I'm still getting this text from them asking me about my symptoms and if I've had COVID and all these things. We're reporting incidents where they're looking. I mean, Johnson, they had 6 cases of the blood clot, and that was enough for them to put a hold on it to look closer. 6 out of millions. That was enough. So they're looking for
But according
problems.
to my Facebook feed,
And look, this is
everybody got it.
So the government's not pressuring you to lie about the side
No.
effects. So what are the real, true, you can say, here's documented side effects that we know?
Because I have seen at least
Yeah.
12 different Facebook people talk about heart inflammation,
inflammation.
in
Myocarditis. I can't even say it.
Myocarditis.
Yes, there we go.
Myocarditis and pericarditis. And so this one is real, and it tends to be more in adolescents and in young people. And it's an inflammation of the heart muscle. What we can say is that it's rare. So I know, one person shares something on Facebook, and then it goes to everybody, and then
everybody shares
and then you
it.
feel like you've seen it or you know somebody, but you don't actually know that person. And you don't know about all the millions of people who got it and didn't have that happen. So they've looked at it, and part of it is is the incidence of myocarditis actually higher, or are we looking for it? So it presents with chest pain and shortness of breath. Can I tell you, how many times after the flu have you experienced like some chest pain and shortness of breath that was, I'm still just getting over it, and it goes away in a few days, right? So what we found is we are diagnosing it, but we're looking for it. We're taking every complaint very seriously and doing all these tests and imaging, looking for it. Most of these kids have been very mild and have fully recovered without with very simple treatment, NSAIDs. So that's ibuprofen, that sort of
And there's no
medication,
long-term
steroids.
impact on them.
No, but they're watching them. So they're having those kids follow up and they're looking at them long term. But we can also say that we've seen the same thing with COVID. And so COVID can also cause myocarditis, pericarditis, and can cause heart problems more long term. I've seen folks who were, running miles per day and now they can't take a flight of stairs because of the damage COVID has done to their bodies. And so it goes back to this, do I want this new vaccine that may have side effects? Yes or no? Oh no, I don't want that. But that's not an option anymore. The option is you're going to get COVID. Mm-hmm. You're going to get it. Everyone's going to get it at some point. There may be the minority of people who don't get, if it's not this variant, it'll be the next. We're all going to have had COVID at some point. And so are you going to wear your seatbelt or not? Do you want COVID with the protection of the vaccine that gives you a milder illness, or do you want to take your chances with this variant or the next variant that who knows what damage it's going to do and what complications it's going to cause long term? Vaccines that we have seen, the history of vaccines, none of the non-live vaccines have ever caused side effects beyond 2 months. We see what they're going to do within 2 months. Why? Because it doesn't hang around in your body. Even with the mRNA, it goes in, it makes that protein, it chops up the instructions, and it's gone. The products from the vaccine don't hang around. But you say, what about Zantac? We had Zantac forever, and they just pulled it from the shelves. But that's a medication you take day after day after day with constant exposure. You're not being constantly exposed to the vaccine. It goes in, it's gone within a matter of a couple of days. The vaccine's gone, and all that's left is your immune system's memory. So it's very unlikely that this vaccine is going to be any different. I don't expect that we're going to see a side effect months or years down the road. The side effects we see, we're going to see immediately.
I'm sorry, this is the longest podcast ever, but it's great information.
Okay.
Last thing I want to, because I noticed people thinking this, okay? So I got COVID, got the antibodies, and then at some point the antibodies lessened. So what's the difference? Succinctly tell me, what's the difference between my body forgetting what the antibodies learn versus what my body learns from the messenger RNA? Is there a similarity between my body's going to over time forget?
Sure. So with the messenger RNA, instead of it being exposed to all the pieces and parts of the virus, we're giving it something specific. So instead of like a group picture, it's a picture of the one guy. And so the memory from the vaccine seems to be better. And theoretically, we can't necessarily say, this is something that we have to see over time. I've personally seen people who've gotten COVID more than once. There is good evidence that perhaps if you had COVID, whether or not you got the antibody treatment is different. But say you got COVID and you recovered, and then you get one dose of an mRNA vaccine, that's probably similar protection to somebody who's had 2 doses of the mRNA vaccine. Because that first one, we don't just get one dose, we get the second dose. So to kind of do your test run to make sure that it knows what it's doing. The first one, it gives you the picture of the bad guy. The second one is, okay, now let's do our trial run of how we're going to fight him off. And so it needs that kind of second exposure to really get that immune response. And so if you've had COVID, I still would recommend getting the full vaccination series, if nothing else, for a convenience factor. One, it's probably not going to hurt you. We've proven that they're pretty safe. And now that Pfizer has gotten full FDA approval, lots of places are starting to make vaccination mandatory.
It's just going to be it's just inevitable.
So if you want to go back to living your normal life, you want to go to the LSU games, you want to travel, you want to get on an airplane, you're probably going to have to show proof of vaccination whether or not you've been infected.
So let me ask you this. Last thing I want, anybody watching this, can you direct them to places? I feel like this has been a good conversation, but we could talk probably for more hours. But is there a good place they could go? And Frank's going to probably jot this down and put it on the screen, that they can go and get unbiased data to help them continue through hopefully you go to your local doctor, start there. But if that doesn't convince you, here's some additional places that can reinforce that information.
Yeah, so the CDC posts, I think, the most user-friendly information that kind of breaks it down. And their site has a lot of different things. And on the CDC site, it also has links to other places where you can get more information. Look, if you try to go into the studies, you're going to get bogged down with a lot of jargon and a lot of numbers and a lot of things that are really difficult to dig through. So don't do that. Trust the experts whose job it is to do that sort of thing. I think talking to your local experts, listening to your local pediatricians, your local infectious disease doctors, not some doctor who's in a different state or across the world, across the country, wherever.
Or take that guy's information and present it to your local doctor and let him explain it to you. Right?
Yeah.
So CDC, I know the CDC's the government. I know what's going on in some folks' minds. At the end of the day, for me, here's what I did. I reached out to Dr. Foreman and a lot of other medical professionals that I know and people that they know. And for me, that was, I trusted that information, and it was all on the same playing field. They all felt safe, effective, and have been vaccinated. And then none of them are being paid to tell me that.
That's right. And I can't endorse something more than saying I've taken it. I've told my husband to get it, and he has. I've told my family members to get it. The people that I love and care about, the people closest to me, that I've encouraged them to take it. I can't recommend something more than to say
You did it.
that
you've done
I've taken it
yourself.
and I give it to my
It'd
family.
be like me, like, hey man, I'm an insurance agent, but I deal with this. All my insurance is over there at this other guy's insurance
Right,
place.
exactly.
Like, then why would you do business with me? And if I don't even do business with myself, right? It's kind of a similar scenario.
So that's the biggest recommendation I can give to something, is to say that I looked into it, I talked to the people that I know are experts that I trust, and that I came to the decision that I should give this to my family and the ones that I care about. And so I don't just, do as I say and not as I do. It truly is both.
Yeah.
Well, thank you so much for spending 50 minutes with us. You are officially our longest, and I think most informative guest that we've had. I've enjoyed. I could keep talking about it.
I mean, that's why whenever at the beginning he was like, "You and Windi are going to take over," I was like, "Where's Maury Povich that comes in and says we've determined that was a lie?"
That was a lie.
Because we know he can't just be quiet. But you explained it so much where.
We're not trying to tell you to get, this isn't to convince you of anything other than to say, here are facts, okay? These are facts. Yeah. Go talk to your doctor and make the decision for yourself. I think it's inevitable that as we move and we see these different variants, it's probably just going to be a way of life in the future. Just like the polio vaccines and all the other vaccines are current, normal, except for that small segment of the population that are anti-vaxxers. Everyone else is going to accept it and is going to hopefully eradicate this thing or make it manageable.
Those vaccines were new at one point.
And they probably had the same fears.
Yes,
I think
did.
back then they didn't have social media posting to people shaking. So Frank, thank you for thank you for all that you do, for putting all the information on the thing. Baby, thank you for letting me be Maury Povich and talking with you guys. You are way smarter than I am. Finish this out, sweetheart.
I have nothing other than get your facts. Yeah. Shut off external noise. Yep. Dig into it for your family. You owe it to yourself and your family. Just do it.
Bridgett, thank you.
Yeah.
So much appreciate it.
Thanks for having
us. Hey everybody, thank you for joining us. If you thought this was helpful, please share it. Be kind. If you want to comment and you disagree, it's okay. We don't have to all agree, but we don't have to be ugly about it. So appreciate you, and share it, and like mitchandwindi.com. See us on Facebook. Have a great day. Be a blessing.